Welcome, everyone. This is part of our Hocking Valley Community Hospital 55th anniversary celebration this year. And if you'll recall, we are doing 55 ways to be a better me, both spiritually, financially, emotionally, and physically. So today we're going to kind of talk about poverty, what might cause that, ways we might overcome that to be a better person. So I have a couple guests with me today, and I'm just going to let them do the introductions of themselves. That way you as the listeners know that we do have the experts online here today to help with questions and answers. So Doug, if you want to go ahead and start.
Hi, good morning, everybody. I'm Doug Fisher. I'm the health commissioner here at the Hocking County Health Department, and real glad to be on the call.
Good morning, everyone. My name is Jody Walker. I'm the executive director of South Central Ohio Job and Family Services. We're a multi-county agency, and we serve Hocking, Ross, and Vinton counties. And I'm happy to be here today to answer any questions and hopefully talk about poverty.
Thank you. Thank you both for joining us today. So we'll jump right in and kind of play off of each other, do whatever works best for you. Someone start and kind of tell us what is poverty? What are your true definition of that?
Well, Jody, I'll kind of let you start off because poverty might mean a little different thing to the health department and to community health than what it does to you. So maybe you could start off.
Sure. So when people talk about poverty, a lot of times they want to assign some numbers, especially from a governmental standpoint, to get a better idea of who's in poverty. So the Office of Budget Management looks at defining poverty as a income threshold. So a lot of times when we're talking about poverty, we're talking about people who are at or below a certain amount of money in their household. So an example would be to be considered in poverty in the United States, someone that makes less than $13,000 a year, that's one individual, would be in poverty. If you had a household of 3 people, that could go up to 20,000. So as you add people into the home, whether it's children, whether it's spouses, those numbers increase. And the reason why the federal government likes to put a number on it, because there's a variety of different programs out there that people would qualify for different types of assistance to help individuals who are in poverty. But a lot of times, though, it's just not poverty as far from a financial standpoint, even though financially it impacts a lot of things. It's really whether or not someone can meet their basic needs. And, when you're talking about basic needs, you're talking about housing, food, employment, healthcare, transportation, things that people need every day to survive and live. And I know that Doug will probably talk a little bit more on the healthcare side, but when you have people that are isolated, that don't have access to those types of things, that creates a lot of problems. So really, you can look at poverty as one from a financial perspective, but two, from access to just the basic needs, not what people want, but what are considered basic for people to survive on a daily basis.
Okay. Jody, can you also tell us, would there be can you tell one sex over another that might, are there more men, more female, more adult, elderly age than children that are in the line of poverty?
So I went ahead and pulled some numbers. In Hocking County, the highest, it's females, and the age group is 25 to 34 are the highest amount of individuals in poverty.
Really?
Yes. And then the next group is followed by females 55 to 64, and then females 45 to 54. The only subset is not the 35 to 50, 35 to 45, basically, isn't in that, but it's really females 25 to 64 for the most part are the most at-risk group. Now, 21% of the children in Hocking County are considered to be living in poverty also. And then 13.6% of the population is at or below the poverty line, which is a little over, it's like 3,700 people. And the national average is 13.1%. So it's a little bit above the national average. But there's other things that come into play though too. When you look at poverty, it's the people that would be considered maybe not in poverty, but just above the line. So you have a lot of people that are underemployed possibly, or may not meet that definition, but then are just really struggling day to day to meet their basic needs.
Okay. And clearly Hocking County is a rural county. Does that, I'm guessing, have some sort of effect on that? Is there maybe one, how do you know one county over another in the state of Ohio has more poverty than another? And is that, do you find that it's because that it's a rural county?
Yeah, so when you look at Hocking County is one of the Appalachian counties. There's, I think, 33 in the state of Ohio. The Appalachian region actually stretches from New York down into the Carolinas, maybe Georgia. But in Ohio, the Appalachian counties go from up north at the, I think, Ashtabula, all the way down to Lawrence County and over to Clermont County. And Hocking County is considered an Appalachian county, and it is a rural county. So when you're looking at it from those points of views, you have transportation issues. I know that the commute for workers in Hocking County is 30 minutes one way, and about 50% of the workers commute at least a half an hour every day. So whether they're driving into Logan, Athens, Columbus, Lancaster, they're commuting. And so there's a lot of transportation for a rural county, which means, if you're commuting a half an hour, you're usually driving about 30 miles because, you're going someplace. But yeah, being a rural county impacts that on the poverty side, just because of access to different things, employment. While Hocking County's unemployment's low, you also have a situation where you may have a lot of individuals that may be considered underemployed too, that aren't making enough to really meet their basic needs, which I kind of mentioned earlier. But yeah, the rural perspective, generally you'll see poverty higher in rural areas, and then concentrated in like inner city parts of the metropolitan counties too.
Okay. And clearly based on the statistics that you gave financially in any ways, all people in poverty are not just homeless people. They're your regular people who are trying to thrive and carry a job and make a living. Is it common for poverty level people to have, how should I say, multiple families living in one home together? Is that something that's common to do to help in the situation? And I don't know, Doug, between you or Jody, which is the best to answer that question?
Jody, we see it here at the health department that household income determines, a person's situation. And often we do see families living together to help with that disparity, that problem of low income.
Yeah, I would agree with Doug. The lack of affordable housing is always an issue, especially, for people that are, at the poverty line or just above it. If you're making, let's say if you're making $15 an hour and it's you and two kids, and, you're bringing home $1,600 a month, but, your rent's $1,000, your money goes really quickly when you look at that. And then other costs to live, you see individuals quickly not being able to afford their own housing, having to live with relatives. You may see some substandard housing, and that, when I say substandard, it just might not be the best type of housing available. But those are all issues we see with people who, sometimes stack up, which isn't always good, especially with the pandemic too.
Sure.
So yeah, and actually with the pandemic, which kind of impacts some of the homeless issues, and I know Doug can talk more about that probably, people aren't as willing to let people stay with them right now too, just because of the pandemic. And it creates some stressors for families who may have housing issues.
Okay. Doug, would you like to carry on with that?
Latricia, public health wise, community health, population health wise, we do see things a little bit different, but we definitely recognize that these type things like poverty, which fits into social determinants of health, and the term social determinants of health is a rather new term for especially for healthcare and so on. But those social determinants of health are the conditions in which we are born into, live, work, and grow old. And, I just was telling my son the other day, it's the household that you're born into is like winning the lottery. It's like a lottery, and some folks have it better than others.
Right.
And, and we're finding out that as we study these social determinants of health, which includes, your household income, it definitely determines your health. And, poverty is both a cause and a consequence of poor health. So, as we look at it, the social determinants of health, I mean, it gets into a lot of different areas. It gets into those social and economic factors, which that's what our income falls into. But it's not only that, our income determines whether or not we can go on and get a good education beyond, high school, and how well then we're employed and those type things. But it also reaches into, our most recent community health assessment that we haven't even formally released yet, suggests in there that our income also will determine our tobacco use a lot of times, our diets, our alcohol use, those type things. So it's these social determinants of health that cause all these inequities, these disparities amongst the population. And we see it here in Hocking County. You're muted, Latricia.
Okay, I got it now. I was going to ask Dr. Fisher, do you find those families or those individuals that are, in the group of poverty level, do they tend to lack their health care that they need, or is there funding available that they take advantage of, or do they not? How does the clinical side fall into that with people in poverty levels?
I'm going to ask Jody maybe to speak to, access to funding and so on. I think he's more of an expert, hopefully, than what I am. But like I say, it definitely determines, our access to care, our access to education, our access to all these other things. For example, our community health assessment says that those with household incomes of less than $75,000, and there's many folks out there that don't come close to having a household income of $75,000, are more likely than those with higher incomes not to get prescriptions filled. So, talking about funding, folks, is there funding out there to help these folks with their prescriptions and so on? And I think there are. I think pharmacies have programs and so on to assist these folks. Those with incomes of less than $50,000 were more likely than those with incomes of $50,000 and more to have to be able to seek out mental health help professionals. So, again, our income determines our access to healthcare and mental health professionals in mental health care. So it's just these type things.
Okay. And Jody, did you want to add anything on to that as far as do they go after healthcare? Do they do the necessary things they need to do to stay healthy? And is that affordable? Is there help for them?
So in Hocking County, we have about 25% of the population on Medicaid. So there's a little over 28,000 people in Hocking County, and there's a little over 7,000 people, currently about 7,200 that are receiving Medicaid. So that's about 25%. And then when you look at that, the penetration rate as far as the eligible population that takes advantage of that, I think in Hocking County, we do a good job making sure people who are eligible for the service receive it. I think what we always have found, and Doug, the health commissioner, can probably speak to it, is on the preventive healthcare side, we always have people, and I think it's a rural issue, and I think it's an Appalachian issue too, that don't regularly go to the doctor, so they wait till it's an emergency. So they're using like the ER for primary care, or they're going to, they wait till it's a major problem. Then generally we see other health issues come out of that instead of taking care of preventive health issues by regularly going to the doctor, which then in turn has costs. And I think that the health commissioner laid out as far as like, you see that with the income guide, the income in the household, because people feel whether they can go to the doctor or afford to get their prescriptions. So they're cutting corners, and then it leads to more healthcare issues long term. But as far as access to health insurance, I think we have a lot of the families who are eligible signed up, and with Medicaid expansion, it covers a lot of those individuals who in the past, that 19 to 64 population, as long as they meet the income guidelines, are eligible now, versus in the past, you had to be either part of a family or an age blind disabled household. So there's more people covered than what we had, say 10 years ago.
Okay. From a clinical side, Dr. Fisher, if you can answer, and if not, certainly pass it on to Jody, but with the pandemic that's going on, have you noticed, has COVID affected homeless people or poverty level in our area?
Yeah, we definitely are seeing, some cases occurring in our homeless population, which is concerning because of their access to care. But I feel very fortunate to have partners like Job and Family Services and Jody and others, because we have been able to work together here in Hocking County to address some of the situations that we found. But definitely this COVID has isolated people, and our concern is with our substance abuse disorder folks as well, in their ability to seek care during this time and so on. So yes, definitely COVID-19 has definitely played into people's ability to seek care and so on. Folks are just staying more isolated and then waiting until cases are more severe or more concerning before they seek care. So that's a major concern.
Sure, that's unfortunate. Well, we'll get ready to close. I had just a couple more questions, and you can certainly divide them between the two of you or whoever feels more adequate to answer. But if I, as a person, as a listener out there, found myself, in that low income or poverty situation, where would I start to find help and access? What would I need to do? What steps would I need to take? And then question number two, for those who would like to help, the world poverty situation or in our county alone, what would be things we would want to do, or how could we help? So that's kind of a two-part making me a better person in 2021 question.
Jody, I think you might be more the expert to advise people where they start.
Sure. So if someone was wanting to apply for any type of medical help through Medicaid, food assistance, limited cash assistance, or just maybe get pointed in the right direction of who's available, they can contact our agency. They can go to our webpage, which is secojfs.org, and it has all the services that our agency provides. We also have our 1-800 number that you can call if you would want to apply. We can do a lot of our services over the telephone. And a lot of times we get people asking for housing questions and different issues, and we try to point them to the different other social service organizations in the community that can help them with that. But our 1-800 number is 1-855-726-5237. And that generally you'll call in, and then if you're looking to apply for any type of benefit that our agency has, will begin your application process for that. And that could be childcare, transportation if you currently have a medical card. Excuse me. So those things are available. And there's a lot of other resources in Hocking County, from metropolitan housing to community action, that can be a great support for families who may be struggling. And as far as from an individual perspective, You know, I know a lot of people, they volunteer their time either with faith-based, with some community organizations, the food pantries. I think that, you know, Hocking County has great support for our social service agencies, and you see that with the passage of the levies that support a lot of the community organizations. So I think that goes a long way with them showing support for what we try to do with families who are at the most risk. But Doug.
Okay,
So-
Dr. Fisher, anything you would like to add?
Yeah, so regarding the health department, some of the services that we provide are listed on our website as well, and that is www, all one word, hockingcountyhealthdepartment.com, or you can call and inquire through phoning us 740-385-3030, and folks would be glad to help you with that. But just some of the more common services that we provide for those that are less fortunate. Of course, we have the WIC program for the county here, and that provides pretty significant services for those folks. You know, we are concerned, like I mentioned before, with our substance abuse disorder clients, and we have actually Standall here, which is a community health worker here at the health department, and she would be glad to work with those folks that are less fortunate there as well. And you know, it sometimes gets overlooked, but those that are less fortunate and have lower incomes, they also have to maintain those homes. And one of the systems that's very important to maintain as far as preventing disease and so on in our community are our septic systems, and our environmental health professionals, specialists here at the health department can help folks with that as well. If they have failing or you know, problems with their systems, there is funding available here at the health department. So if people want to inquire about that, please do so here at the health department.
Okay, well, this has been very informative, and I thank both of you, Dr. Fisher and Doug Walker, for joining us today. And certainly thank you to your organizations that you oversee for all that you do to better our community as a whole. Anything else that you would like to add to today's session that we had? Maybe something I forgot to ask. I was going to ask Jody one question. You had mentioned Medicaid. You kind of referred to them a lot in the level of poverty. Do individuals with Medicare fall under poverty as well too?
Yeah, so Medicare, you know, obviously is the program for individuals 65 and older. There are some individuals who are on Medicaid, Medicare to help pay for their premiums, but it's a different type of a needs assessment that's done, and it's not as many, unfortunately.
Okay.
But we do work with individuals who are on Medicare, and honestly, a lot of individuals who are on Medicare are at or below, they're right at the poverty line anyways, because they're on fixed incomes through Social Security or some type of other retirement. So they're a concern too, because there are more vulnerable population, the elderly, and making sure they take advantage of healthcare and feel like they can afford it.
Right. So then they would be able to reach out to your organization as well?
They can, but we don't have as many people that are like dual Medicaid, Medicare eligible. The income has to be really low. There's some help with some of the buy-in portions of Medicare, but they can reach out and we can work with them because we have a team that works specifically with Medicare, Medicaid, dual eligibility, or for the premium buy-ins.
Okay. All right. Thank you. Well, again, gentlemen, thank you both for joining us today. And thank you, listeners, for being part of our 55 Ways to Be a Better Me in 2021. Join us next time. Thank you.
Thank you.
Thank you.